The Health Professions Council of South Africa has once again warned of the dangers of underage vaping as more engage in the practice. The group has called on stakeholders and parents to limit access to vaping products and for authorities to impose stricter age restrictions. HPCSA President Dr. Kgosi Letlape joins us now to speak more on this issue. Dr. Letlape, pleasure to have you on the program this afternoon. Now, as President of the Health Professions Council of South Africa, how do you perceive the impact of underage vaping on the health of young people?
I think we just need to correct that I'm a past president of the Health Professions Council.
Oh, yes, apologies.
I'm now the president of Africa Harm Reduction Alliance, which is about reducing harm to adult smokers.
Right, that's it.
Vaping, just like smoking, should not be allowed for children. The problem is how do we enforce those things? Just like underage drinking, underage smoking, and even vaping would fall into the same category. And the challenges are, in this modern day, where discipline is not good, we see youngsters getting into behaviors that should not be promoted or encouraged for young people.
So the statistics surrounding underage vaping are quite alarming. What factors do you believe are actually contributing to this increase or prevalence of young people vaping?
What has been found is that, like any other truant behavior at school, peer pressure is a major factor. But because of the relative expense of vaping products relative to combustible cigarettes, this has been found to be a major problem in a study done in affluent schools. When you go to less affluent schools, the challenges will be cigarettes, nyaope, dacha, and other substances. But in high-income schools, vaping has been seen to be a problem. And it's a part of the fanciness, peer pressure, the sexiness of the devices, that it's an electronic product. And those are the issues that attract young people to those adult products.
Dr. Letlape, from a regulatory standpoint, what measures should be implemented to indeed address the accessibility of these vaping products, especially to the youth?
Well, there's not much that you can do except to truly educate. What this shows us is we need to be properly educating youth about nicotine, effects of nicotine, nicotine use, undesirable effects for young people. But we need to make a clear distinction that when you have adults that are addicted to combustible cigarettes, they should be encouraged to look at non-combustible delivery of the nicotine that they seek. So the key issue is going to be education, credible information, so that people can make informed decisions. Young people need to be taught about the addictiveness of nicotine, the undesirability of picking up that habit, because if you pick it up, it might be with you for a long time.
Mm-hmm. Let's deal with the claim that vaping is seen as being safer than smoking. Is this an accurate assessment? And if not, how accurate information can be used to really avert against the vaping, especially for young people here?
Well, vaping has been clearly proven to be less harmful than combustible cigarettes. In medicine, there's a process of doing what is called Cochrane review, which will look at the literature and all the studies that have been done around these matters. When you look at toxicological analysis of the aerosol produced by a combustible cigarette and the aerosol produced by vaping or other non-combustible systems, right, like IQOS, heat-not-burn products, or smokeless cigarettes, the harmful constituents that we found in the aerosol of combustible cigarette is greatly reduced. So there's no issue on the science about the less harmful aerosol produced by non-combustible products, including vaping. But having said that, they are less harmful does not mean we should encourage youth initiation. So what we need to do, just like alcohol, where we have a problem of youth use of alcohol, remember we had those deaths in the Eastern Cape around underage use of alcohol. We need to educate our children. We need to begin to understand why they are taking these substances and deal with the underlying issues. But one of the things that will empower you as a young person to make right decisions is proper, credible information. We do not need to misrepresent the science to try and deter young people from using these products. We need to be truthful, because remember that these products are useful for adult users. 1 in 2 cigarette users will be killed by the combustible cigarette in their lifetime. So we have 8.5 million deaths that occur in adults globally. We have 30 to 40,000 deaths amongst our 12 million smokers in South Africa. Those deaths can be prevented. A lot of them can be averted by using non-combustible products. But these should not be used by children. We should ensure that there's proper regulation about the concentrations, the advertising, the design, the presentation of these products, so that they do not attract youth. What you need is sound regulation based on evidence, not prohibition based on lies.
So plans to impose an excise duty on vaping tobacco products also include a recognition of the need for more regulatory measures. How can taxation actually contribute to reducing underage vaping and prompting public health here, or rather promoting public health?
Well, the irony is that we found higher incidence of vaping in the high-income schools. The cost of vapes, even if you added duty on it, would not deter them from using those products. But remember that you can't say the tax is added for youth. The tax is not added for adults. We must remember that the focal point is to save lives. If we're going to need to save lives, the price point of this product should be below the price point of the harmful product, those being combustible cigarettes. You will see in developed nations that the tax associated with relative reduced risk product is being reduced. Sweden has just passed through their parliament a 50% reduction of the tax imposed on smokeless tobacco they call snus, because they recognize the public health benefit and the fact that it has saved lives throughout the 50-year use of snus in Sweden. So we need to ensure that the less harmful products don't cost more than the most harmful product, being combustible cigarettes. And remember, combustible cigarettes, the greatest amount on the price is tax. We now have illicit product post-COVID that has gone up. So you find cigarettes that cost less than the amount of tax that needs to be collected per pack of 20. So we need to be careful that when we tax these issues, we don't tax them out of reach for people that need the relief of less harmful ways of getting their nicotine. So tax should be less than the tax that we are imposing on combustible cigarettes. But we need to factor in the issue of illicit cigarettes, which is obtainable very cheaply to the communities. And we need to ensure that access to less harmful products is not more difficult than access to the harmful product.
But then I guess it also begs the question as to how can vaping shops themselves, the government, the media even, parents, schools and law enforcement work together to create a comprehensive strategy against underage vaping?
The key issue, in my opinion, all those matters are important, but the key issue is education. Education, education, education. What you then need to do is enforcement, where people need to be searched. So we need to educate the students. We need to educate the community. We need to educate the families. We need to educate the parents. We need to educate the teachers. And we should then be engaging with our youth as to why are they using these products. Look at the causative factors that drive them to this. But they need to be empowered with information to be able to make the right choices. You then have the issue where regulation is important to ensure that the components that go into these e-cigarettes and the alternatives are safe. If you remember, a few years ago, there was a problem of what you called EVALI, electronic vapor-associated lung injury. It was then thought it was nicotine, but it was found that it was not nicotine. It was cannabis vaping laced with acetate, which caused the problems. So regulation becomes important, just in terms of ensuring that you have proper product, according to proper product standards, limiting the amount of nicotine that can be in an e-liquid. Regulations is how you make the nation safe, not prohibition. Because when you prohibit, the product goes underground. You got illicit product that comes out. You cannot set the standards. You cannot measure the quantities that are being sold. You cannot collect revenue, tax revenue on these products, and then you are endangering the lives of society because you are disabling yourself from protecting the public. So there has to be a tax regimen just like any other product, but the tax has to be less than the tax that we impose on combustible cigarettes. We've got to ensure that alternative products are accessible, they are safe, and they are available. And we've got to ensure that the people that sell them, why can't we create tobacconist shops? Why can't we create special shops where you can get your vaping instead of it sitting in the corridors? Why don't we make regulations that it will be in appropriate shops where people are educated, where underage children are not allowed in? But the important thing is to educate society so that you don't have adults that go and buy on behalf of minors. In this modern age, there'll be challenges about internet sales, etc. So the key issue becomes education, vigilance from parents, society embracing, talking to our kids and educating them properly to stay away from things that are going to hook them, addict them, and cause harm. But we need to ensure that these alternative products are available to adults who can't quit.
Let me thank you for your time. That's Dr. Kgosi Letlape for your insights into this critical issue of underage vaping and the necessary interventions that are also required to help curb against this phenomena.